So foramen cecum is this little hole right there, yeah? All right, that's just for an emissary vein. That's no big deal. Cribriform plate, that's cribriform plate. All right, what sits in cribriform plate?
Olfactory.
Olfactory nerve, cranial nerve 1. Next.
Anterior and posterior ethmoid.
Okay, so we look at the on the inside of the medial aspect of the orbit. You see very thin lacrimal bone, right? Very thin. We have this big hole here. What's that big hole? Going down in here.
Oh, sorry.
Right.
Lacrimal.
Nasolacrimal duct, right? That in here. That connects the eye with the nose, right? Nasolacrimal duct, that big thing right there. Put that in there. It goes into the inferior meatus, right? So when you tear up, you got fluid coming out of your lacrimal gland, sweeps across, goes down the nasolacrimal duct into the nasal cavity, so your nose waters, right? So anyway, this ethmoid, the medial wall of the orbit, very thin, blowout fracture, right? Kid gets hit in the eye with a baseball, it breaks the inside here because it's so thin. On there you've got a couple of foramen that I can see. There's a posterior ethmoidal foramen there. That little hole in the back there. That little hole right along there. Actually, it's double in this guy. See it or no?
The little one.
Yours is all bust up. Eh? Right there.
Oh, that's small.
Yeah, usually there's one like right about here and one right about there.
What
All right, so there's usually one right about. Yeah, they're really small. There's a nice one right there.
What was that one called again?
So there's an anterior and posterior ethmoidal.
That's an anterior. Posterior, yeah.
Anterior and posterior ethmoidals, and those are from the ethmoidal. Anterior and ethmoidal nerves are from the nasociliary nerve that we'll talk about when we do eye. But that's up in your eye basically. And it's a sensory nerve from cranial nerve 5. But invariably that's damaged, right? Because it's on the medial wall of the orbit. We can call it that. There's a really good posterior one, and there's probably an anterior one right there.
Is that like just a connection between sinuses, or is that?
No, that's so. What we're going to do is we're going to see nasociliary nerve. We're going to break this out.
Oh, okay.
And then we're going to see cranial nerve 5, V1, coming through here. And we're going to break this out, and we're going to see how that runs. That makes a nasociliary nerve that goes medial, and that provides sensory innervation. Those pop through the bone. So it's running along here. It pops through the bone. Sorry, in this direction, and provides sensory innervation to that area. Right, but invariably, that's going to be involved when you have one of these blowout fractures. Okay, because it's going to break the medial wall of the orbit. All right, makes sense? What's the next one?
Optic canal.
Optic canal. All right, where's the optic canal, guys? You guys know that, right? Process. Let's leave this one. Let's not use this one because we're going to bust up this one process. Right, optic nerve. You know where the optic canal is, right? Right through there. All right, so look at the face head on, right? Look at it from the frontal aspect, and you see the orbit, the optic foramen, optic canal is like this, and there's kind of like a V, yeah. So that V is superior and inferior orbital fissure. And on an X-ray, you see that really well. You can do a frontal X-ray, you see these two V's, and you see the little circle for the optic canal. So through the optic canal, there's two major structures. What's the one you know for sure? Optic nerve, cranial nerve 2. What else goes on? Ophthalmic artery. What does the ophthalmic artery do?
What does it do?
Yeah, what does it provide?
Orbit.
It serves the orbit, and what else? It throws us a small branch called the central artery of the retina. And that goes right through the back end of the eye, and it supplies the retina. And in diabetics, that'll get occluded, person goes blind. Right? That's why blindness is a common feature of diabetes. Because that central artery retina, that's all that supplies the retina. If that goes out, then that's the end of the retina. All right? Superior orbital fissure. What goes through superior orbital fissure?
34, V1.
Right. Everything else that supplies the eye, right? So what is that? Is that? Tell me.
3,
3, 4, 6. V1 comes out, supplies the upper head, the forehead. All right. So, what's next on that list?
Foramen rotundum.
Foramen rotundum. Put a string through the foramen rotundum. What's the foramen rotundum?
V2.
V2.
That one, right?
No. there.
That's a tough one.
You got rotundum. You got rotundum.
Oh yeah.
Rotundum, right?
Cannot
What
make
goes
it
through that again?
V2.
V2. Where does V1 go?
Superior
Superior
over
over
fissure.
fissure. So put your string in through superior over fissure. Look what the relationship is. What we're going to do on next Tuesday
That's V2.
is we're gonna make a cut. We're gonna do this cut. We're gonna pull off the cranium. We're gonna pull the brain back. Eventually, you're gonna pull the brain out, and you're gonna pull up the meninges on the other side here. What do you think is right where my finger is, right there, on the other side?
Trigeminal.
Trigeminal
Ganglion.
ganglion, huge ganglion, right? Because it's all sensory fibers for the face.
That's here.
So when you pull that up, you're going to see V1 going through superior over fissure, and you're going to see V2 going right through foramen rotundum. V3 goes through what hole?
Foramen ovale.
Where's foramen ovale? Right.
Where's the ganglion?
The ganglion sits right between. This is the.
Is it?
That's where the
The one that looks like an
pituitary
oval.
is, right?
That's what I
And on either side of that, yeah, and it's huge. And it's like this huge ganglion, and it's V1, V2, and then V3 comes out.
We're looking for the
So
cave.
where exactly is Meckel's cave?
Right, so Meckel's cave is. Where'd you hear about Meckel's cave?
It's in Blumenfeld.
Okay. So what happens is this: the brain stem's right about here, right? And the motor and the sensory branch comes off, and what it does is it shoots right through the meninges, and the meninges kind of wraps over it. So that's called Meckel's cave. So once you get in there, the ganglion's on the inside. But it's going to kind of mess you up because you're going to pull this out, and you're not going to see the ganglion because the ganglion is like underneath the meninges. What you're going to see is just the root of fiber in there, and then you're going to kind of peel that out, and you're going to see how it's like an opening there. It's like the entrance of a cave because you open this up, and then there's this huge ganglion on the inside. Okay? Make sense?
Yeah.
All right. So look at foramen ovale. Look at the little hole right behind it. What's that called?
Spinosum.
Spinosum. What's that for?
Middle
meningeal. You see the groove of the middle of the middle meningeal? Here's a really good picture right there. You see how that comes up, and then you see the groove coming there, right?
Nice.
I know.
You see spinosum. You see the groove from the middle meningeal. Look at this huge groove right there from the middle meningeal coming around to the spinosum.
Beautiful.
That's how you remember.
Right, so look how thin this is. Yeah, you get a shot to the side of the head, right around. This is called Tyrian right here.
Yeah,
where the
right under the
H is.
Tyrian.
You can break the middle meningeal artery really easy.
Where is it? It goes up here?
Yeah, see how the groove goes like right up in here.
Oh yeah. Okay.
All right, and the middle meningeal is a branch of what? Where's that coming from?
Maxillary.
Maxillary artery, right? And that's coming up, and what nerve splits around it that we dissected? Coming off of V3?
Oh. Something with auricular?
Yeah, that's half. Get half credit on that one. No, that's too bad. You lose the full credit, Don. Auriculotemporal. Auriculotemporal, right? Auriculo, it's going up to the ear. It's going to the temporal region. And it splits around middle meningeal and then continues up. That's all V3. So V3 is sensory innervation the whole way down. What's this little nerve coming out of the mental foramen?
Mental.
Brilliant. Yeah, mental nerve. So auriculotemporal, mental nerve. That's all sensory innervation there, yeah, from V3. What else you got?
Last room. Foramen last room.
All right. So now we're going to take a little break. And before we go do lacrum, well, let's do lacrum and then we'll talk about your illustration. So let's look for foramen lacrum on the inside. And it's analogous feature, or its corresponding feature, the internal carotid canal on the outside. All right, so foramen lacerum. Yeah, that's foramen lacerum. Now let's turn it over. Actually, let's do it this way, guys. Let's just look on the bottom for the external aspect from the inferior side, and let's just talk about two holes. Carotid, foramen for the carotid, internal carotid foramen. Right, this big, nice big round one on the. Look at it on the base. Turn it over. There you go. Right there, nice big round one right there. See how there's this like canal right there? So the artery goes up and it's sealed off at the top, right? And then it goes forward in that canal, and that's foramen lacerum. See how it's
Yes.
So lacerated, that's the canal for the carotid, right? The carotid goes up. What it does is it goes forward, and there's the lacerum. See this like little canal right there, that little tube? Nice little tube right there. And then lacerum is right there. See how lacerated the form the thing is? See that? How that's a nice tube going through? Foramen lacerum right there. All right. So what the internal carotid does is the internal carotid goes up through that hole on the cranial base, goes forward, and then goes up again. All right. So that's a lot of times with embolisms or with clots are going to get stuck there, right? Because they're 90-degree genues. They're 90-degree turns. All right, lacerum is closed off on the bottom. So the carotid goes up, there's a roof, has to go forward, but it doesn't go back down, right? What it does is it's got to go up because it's closed off at the bottom. And it's cartilage. That lacerum on the bottom is sealed off with cartilage. And you know where the cartilage is coming from? Why do we got cartilage down there? We got cartilage because we got this hole right here.
I think last time you said for the eustachian too.
Yeah. So much for thinking about it.
Got you, cheater.
Well, I didn't want to sound smart, so
Yeah. We might begin to expect things, right?
exactly.
Right there. Right there. So put that oops there. That's a good one. Let's go here.
What are we going through?
Are you station 2?
Non-existent.
This guy didn't hear too well. Oh, this is really weird. I haven't.
When it goes back from the tube. It should be that.
I picked a weird one.
There you go. That's that. Okay. It's not so bad.
Or, no, that's...
Okay.
See how that?
Show it on this one.
Sure. See how this string goes right by
Away.
foramen lacerum?
Away from
So-
the tube.
That's the eustachian tube. All right. See how foramen lacerum is right there? It's right there. Yeah.
So nothing goes through there. Sure.
Not really. No, not really. It's sealed off by the cartilage of the eustachian tube. All right.
So-
So these. Go ahead.
This is the, what's that one called again?
That's for the internal carotid. The foramen for the internal carotid.
Okay, so it goes through and then it pops through a canal.
Right.
It can't come back because of this
Right.
cartilage, and then it goes up through,
Right up through that hole right there.
which is also called the.
Um,
Is that foramen lacerum?
No, that's
Oh.
not foramen lacerum. All right, foramen lacerum is just the hole at the bottom.
Okay.
That's still the carotid canal.
This is from
All right, the carotid canal just goes up, forward, up.
And this
That's
is
like-
carotid.
All right. All right. So the eustachian tube. What does eustachian tube connect? Why you got a eustachian tube?
Here too.
Middle ear to the oropharynx, or nasopharynx, really. Sorry, into the pharynx, basically. All right. So that's the connection between the oral cavity through the respiratory system, essentially, to the middle ear. Right. It's not to the inner ear. It's the middle ear. So when you're going up in a plane, you got to equalize. You swallow, right? Because you're equalizing the pressure on the inside versus the outside of the tympanic membrane, basically. So the canal is bone, and then it's cartilage, and then when we do a cross section of the head, you're gonna see this big hole going right in the nasal pharynx. All right. The point is that tube is made of cartilage, so it seals off the foramen lacerum above. All right. All right. What's right behind the internal carotid canal? The carotid canal. It's this big hole right there.
Jugular foramen?
Jugular foramen. Can you guys find the jugular foramen?
Can't find it. Oh.
No.
Well, this great big huge thing.
This one.
This huge thing right here.
right
This whole thing,
Yeah,
right?
that one.
Internal jugular vein's huge, right?
Yeah.
We saw that. Where does that originate? What's the origin of the internal jugular vein?
Sigmoid.
Absolutely, sigmoid. So if we look on the inside, we can see the sigmoid groove right there coming up, transverse,
Wow, that's pretty good.
and then back to the to this thing, what is called the confluence. Thank you. So there's a jugular foramen. See this big groove, this S groove? That's sigmoid.
Ah.
right? You can see it here, sigmoid there, and then transverse here.
So this is sigmoid, this is transverse, this is confluence.
Confluence, right.
And what is that one coming?
That
I mean,
is
this
the
is
superior sagittal that goes in there,
sagittal.
and then there's a inferior sagittal from the. There's
the side of the brain?
Yeah, yeah.
Okay.
The straight side.
Can I ask you a quick question?
Yep.
The external jugular, where does it terminate?
The external jugular.
I was just trying to
Help
figure
them out. Yeah, that's a good question. So, where does the external? We know the. Well, we'll find out the termination of the internal jugular. But where does the internal? How does the external jugular? Sorry, the external
jugular vein.
jugular vein. Okay, where it basically it's very superficial.
Right.
Comes down and it's variable where it hits. Sometimes it'll go right into the subclavian. Sometimes it'll go into the base of the internal jugular.
Okay.
There's also an anterior jugular. There's an anterior jugular that goes down like this and can go into that. But I don't care that you know that because it's really variable.
Okay.
Where were we? Jugular. What else comes through the jugular foramen?
9, 10, 11.
9, 10, 11, okay? All right, so having said that, where are we at on your list here?
Here it is, superior petrosal nerve.
All right, we kind of skipped that one, right?
Okay. Spinosum, you did that one.
Internal acoustic meatus. All right, let's do some of that stuff now. All right, so what we're going to do is switch over to your illustration, this illustration. And we're going to do, we're going to do some, thanks for that. Thanks for coming up with some extras.
Not a problem.
And crayons.
So what we're going to do is we are going to go through this thing and we're going to kind of relate it to the skull. And a lot of the stuff you see here, you're going to dissect, right? So this isn't neuroanatomy here. I mean, this is stuff you're going to see. All right, so let's start with the easiest thing first, the trigeminal. Where's the trigeminal on that picture? Yep, yes, right here. Okay, there's the ganglion right there. There's the trigeminal nerve. So this is the root of trigeminal, and that's where Meckel's cave is, like right about here, right? Can I use one of your pencils? Just real quick?
Your own copy
No,
as well?
I'm just gonna draw it on here. Okay. So Meckel's cave is right about here, yeah, because this root comes in, and then the meninges is like here. All right, so once we pull that off, we get the ganglion. All right, so what's in that ganglion?
Cell bodies.
What kind?
Sensory.
Sensory cell bodies. All right, so there's cell bodies that are like bipolar. So one fiber is going to go out, one fiber is going to go in. So it's like this. One fiber goes out, one fiber goes into the tract, the trigeminal spinal tract, and then the other one comes out this way and goes to receptors. Right. So the impulse hits here, goes in, and then goes in here, and then it'll synapse to various other places. All right, so the point is that's a sensory ganglion. That's a sensory structure. All right, so what else we got on your picture? You can see V1 going up to the eye, V2, and where does V2 go? It goes through foramen rotundum, and then V3 is going down through foramen ovale. All right, we understand that. So V1 is sensory, V2 is sensory, V3 mixed, right? Sensory to the lower face. What's it motor to?
Mastication.
Mastication, exactly.
And the tympani.
Tensor tympani, a few other things, but muscles of mastication. So there's motor, but understand that the motor is coming out of the motor nucleus of 5, right? So you've got motor nucleus of 5 fibers that are running through there. They're not synapsing in that sensory,
But they're going through it.
but they're running through it.
Yeah.
But they hit that ganglion and they go south, right?
So they're coming out of here and they're going through here.
Right,
and then down.
exactly. All right.
And out this guy?
Not really with lingual nerve so much because lingual nerve sensory, but there's going to be a motor branch that comes out here in muscle mastication, right? So they come out basically individually. They're going to go individually to temporalis muscle, masseter muscle, that kind of stuff.
And you said these ones are going into the sensory.
Right,
nucleus.
that's all sensory.
And
Yeah.
that goes all the way through the brainstem.
Well, it's going to hit there's this big sensory nucleus of 5. I mean, it's really big, right? Because, it's basically doing sensory through your whole head. But once it goes in there, it's going to synapse on basically interneurons that are going to go to different places, right?
Okay.
Because you've got like, we're going to talk about corneal reflex, right? Where it's a sensory thing comes in and then it's going to go to motor facial, and you're going to close your eye, right? So, understand this is a great big sensory column. All right, so cranial nerve 5 is pretty easy. So put your string through foramen rotundum. So as you put your string through foramen rotundum, where is the string? It's going to go. It goes through the hole, right? Where does it go? Where does it enter once it goes through that big hole?
Inferior orbital foramen.
Fissure. Right? All right, what it's going to do first is it's going to hit this space called the pterygopalatine fossa. All right, so what it's going to do is it's...
I got
okay, let me just get the white one here.
Does the white one show up?
Well, yeah, it's not going to show up that well, so I don't mess up what you're doing. So the pterygopalatine fossa is in this area. This is all maybe it doesn't show up at all. You can kind of see that, yeah? So that's all pterygopalatine fossa. This ganglion is in the fossa. So see if you can find the fossa. Not really? Not really. So it's just kind of a space. So the first thing we're going to do is we're going to look at this pterygomaxillary fissure. See that fissure right there? This fissure here. It's called the pterygomaxillary fissure. Why is it called the pterygomaxillary fissure?
It connects the pterygoid.
It's next to the lateral pterygoid plate. You see the lateral pterygoid plate right there?
It's part of the sphenoid, right?
Yeah, lateral pterygoid plate. It's part of the sphenoid right there. And this is the maxilla. So it's a pterygomaxillary fissure. Make sense? What goes through that pterygomaxillary fissure that you guys dissected? Pterygomaxillary fissure. So we did this dissection here, right? Where we cut the mandible, we pulled that out. We saw a lateral pterygoid muscle going from the plate back to the condyle, basically a horizontally set muscle. Remember that muscle? We pulled that out. We should have seen a big vessel in there, right? Did you guys see a big vessel run into? No.
I remember.
I don't think we did.
What does it start with?
M. Maxillary artery, right?
Only two choices.
But he came up with a verb. Maxillary artery, right? Maxillary artery is a branch of what?
External carotid.
External carotid. Remember, external carotid comes up. It terminates as the superficial temporal and the maxillary. Maxillary goes in because the maxillary's got to get in to supply the nasal cavity. Right? So it goes up. Superficial temporal does the outside of the head. Maxillary shoots through pterygomaxillary fissure to get in the nasal cavity. All right, so if you look inside the pterygomaxillary fissure, there's a space in there, and that's called the pterygopalatine fossa. So we've got a string right here. See the string? Mm-hmm. There's the string. I'll show it to you in a second. My finger is right there, that's the fossa. So if you look in through your pterygomaxillary fissure, there's a space in there, and that's called the pterygopalatine fossa. It's called the pterygopalatine fossa because that's where the pterygopalatine ganglion sits.
Oh. I think I asked you this last time, but is there a reason why it's called maxillary fissure and then pterygopalatine?
Because it's closer to the palatine bone.
Okay.
So as you go in here, there's a vertical plate of the palatine bone. All right, so it's just right in there, right? Right in there. All right, so once you're in that space, you got to think of that space. You can think of that space as a cave too, right? It's this cave, but it's got openings. One opening from the back is the. Oh, I didn't show you, did I? On this thing. Where'd the string go? Oh yeah, right there. See that little depression right there? See this little depression?
Okay.
That's the pterygopalatine fossa.
Okay.
That depression right there, yeah. All right.
Can you see it on the skull like this? Or
Yeah, because when you put it, it's that space right
Oh,
in there.
yeah, okay.
So it's in here.
Yeah, so it's just this space.
Mhm.
It's just
Yeah.
this space right in there. Right in
I hope this works.
there. Yeah. All right, so there's that space. The ganglion occupies that, and that's what's on this picture right here. Right. That's the pterygopalatine fossa is in there, and that's where the ganglion is. All right. So V2 runs through there, right? Excuse me. V2 runs through there from the back. When it goes in there, it can go out the front. And where does that? What's the exit then, or what's the opening to the front? The inferior orbital fissure. Was that what it was? Okay. Inferior orbital fissure. And then that nerve will continue through and go out the infraorbital foramen, V2. We've dissected that, right? You guys have seen that.
Okay. So the fissure is inside, and the foramen is the hole that it comes out of.
Yes.
Okay.
It goes through that hole?
Yes. So there's the inferior orbital fissure.
Yeah.
Kind of looks
See
like
this
a
little
fissure
groove
on
right
the
there?
inside.
Oh.
There's more of like a
So it's going
valley.
to run through that groove where it comes out.
Whereas it's just a hole on the outside. Yeah.
That's the inferior.
Okay, so just while we're at it, so this groove right here for the infraorbital nerve is running on the inferior aspect of the orbit, right? But it's running on the superior aspect of what?
Maxillary
Maxillary what?
bone.
Sinus, right? Maxillary sinus is this big sinus in the maxilla, right? So what happens is it's running along the inferior aspect of the orbit, but that's also the superior aspect of the maxillary sinus. So what we're going to do eventually is we're going to cut right down the middle. We're going to open this up. We're going to break into the maxillary sinus, and you're going to look at the infraorbital nerve at the top of the sinus. Yeah, see how big this sinus is, right?
I didn't follow that.
Yeah, we're going to get to that eventually. But basically, the point is, inside here is a huge maxillary sinus.
Okay.
Yeah. So the nerve's running along the bottom of the orbit
Okay.
at the top of the sinus.
Jenny made that really
So we're
good
going
anatomy.
to cut this,
Okay.
and we're going to bust in from this side, and you're going to see the nerve running along the top
What'd you
of the
call that
sinus.
nerve instead?
That's the
Infraorbital.
infraorbital
Is that the same as
nerve.
V2?
Which is the maxillary
Interchange.
Well,
sinus.
V2 is the whole thing going through foramen and rotunda, but that's going to break up into a bunch of stuff, right?
okay.
One of them is infraorbital nerve.
This is the sinus?
Actually, no. This is the sinus down
Oh, in
here.
here.
That's the sinus in there. See how
Okay.
huge it is? And then when I do that, I'm right about there, and we're going to see V2.
Popping.
So we're going to break here, and when it comes, and that's important because you're going to then when you dissect, you're going to follow that back to get to the pterygopalatine ganglion. That's the way you're going to find pterygopalatine ganglion.
Okay. Thanks.
Alrighty then. So what are these openings? We got rotundum from the back, inferior orbital fissure from the front. What's lateral that we just talked about? Pterygo maxillary fissure, right? That's lateral. That's how the maxillary artery is getting in, right? All right. So there's got to be a medial one, right? Because the maxillary artery has to get into the nasal cavity. That medial one is called the sphenopalatine foramen. So let's try to find that. Sphenopalatine foramen. You just think about the maxillary artery. Maxillary artery is running up this way. It's going through the pterygopalatine fossa. See that little hook right there? That's the foramen. That's called the maxillary artery. Runs up this way, goes through the canal. See that little hook right there, that little opening on the inside?
That?
No.
That little opening right there. That's where the that's how the maxillary artery gets into
Oh, cool.
the
Comes in right like that.
yeah, that little opening right there. Here's a pretty nice one right there. That hook right there. You see that little hook?
Okay.
So if you run this through, that's the route of the maxillary artery.
Sweet.
What hook you use?
That's the maxillary arteries run up this way, and you see that little
So
hook
it
right
goes
there.
into the sphenopalatine
That's
fossa and
that's
out of
the
that
maxillary
little
artery. Then becomes the sphenopalatine artery when it enters into that nasal cavity.
hole. And what is the? Is there a name for the hole that it comes out of?
That little
By the
little
hook?
hook right there. That's called the sphenopalatine foramen. Sphenopalatine foramen.
Becomes sphenopalatine
Artery. Yeah. All right. So we now have something from the back, foramen rotundum. If you're orbital fissure front, sphenopalatine foramen medial, pterygomaxillary fissure lateral. We don't have anything at the top. That's basically orbit, and there's no opening, but there is an opening inferiorly, and that's called the palatine canal. So let's find the hard palates. The hard palate is way up here. We see this hole right here. That's inside the foramen. This is the one I want. Is right there.
These two.
When I run that up, see how it goes in the pterygopalatine fossa?
These two.
That one right there.
Those two.
That big one. This is called lesser. That's greater. But if you run that up, see how it goes back up into the pterygopalatine area.
What is that? What is that?
It's called the palatine canal. Palatine foramen, palatine canal.
Oh yeah, you can
Does
see
the
what
one
runs through
maxillary
there?
artery go through that?
So there's a branch of maxillary artery called the palatine artery runs down. All right, it's going to split actually into greater and lesser. But I think we were talking about this last time. You get a traumatic injury to the face, like in a car wreck. It breaks that artery, and the person's nose just keeps bleeding. What you can do is take a syringe with some saline and just push it in through that, inject it into that hole, and that's going to put pressure on the maxillary artery, and it'll stop the bleeding. All right, so that's a nice way to get to the maxillary artery, right? Because maxillary artery is not that easy to get to.
Put the syringe up the nose.
Well, into the mouth, right?
Oh.
And then right at the back of the mouth, in behind the second molar. And if you find that hole, you can put fluid up there, and it's going to go up that canal and hit the sphenopalatine artery up here. You know how the maxillary artery goes up this way?
And you're sticking
Goes
it like,
through into the nose as the sphenopalatine.
So it's a greater palatine foramen that forms the palatine canal.
There's the foramen that enters, that allows you to enter the canal. That's a tube, right?
canal, palatine artery.
Just palatine canal, and that makes sense, right? Because this is palate. It's hard palate there, yeah?
Yeah.
Yeah. All right. Now, there's another tiny little hole that we should mention, and then we'll continue on with this illustration. And that's this little tube right here. This is called the that's called the pterygoid canal. Pterygoid canal. That canal right there. Right on the picture. That canal right
Is
there.
it this one? That thing?
So close. But it's basically this. I don't know
Oh,
what
it's
this
under
is.
the
It's
medial.
right next to the foramen lacerum, right? And there's an important reason for that. That's not a very good one. Let's see if we can find a better one. Here's a good one. See that right there? That's a really good one.
Wait, let me try to turn it over.
No, we're going to look on the outside here because it's right by the foramen lacerum. And again, you got a good one.
On one side, right?
Pterygoid.
Yeah, I'm not even looking on the other one, but that's a pretty good one.
Good
See how it's
camera
right
work
at the
in
base of foramen lacerum?
Good camera work.
I'm trying. It's gonna die.
Really?
Yours isn't so good. Look at his.
Wait, is it?
Yeah, I didn't try. So this is the lacerum.
That's the lacerum, and then right at the base of the lacerum should be a hole right about here someplace. But again, I'm not really.
Yeah, you can.
It was
Well, that might be it. But usually it's medial. It's like right about there.
okay.
Okay, what is that called again?
That's called the pterygoid.
Without the
Pterygoid
P
canal.
sound.
Okay.
Not the
And
P
the
sound.
V
That's right.
and the greater petrosal nerve runs through.
Yeah, we're gonna talk about that in a minute. Did you find it then, kind of?
It's there, right? But it's, that's
No, actually, it's this one right here. It's down lower, next to the foramen lacerum. See that one right there?
Are you gonna take this one?
You guys should be able to. You're gonna dissect this, believe it or not.
Oh, great.
oh my god. Gotcha.
All right, see how it ends up in the pterygopalatine fossa. Goes through the pterygomaxillary fissure. You can see. You should be able to see the green string in there, right?
Oh yeah, you can see it again.
That's pretty sweet.
All right, so on your picture, that's this tube right here, yeah? And the nerve to the pterygoid canal runs through that. So let's talk about facial nerve now, all right? And kind of put this stuff together. So find the facial nerve on your illustration. Facial nerve. Facial nerve goes through. Facial nerve comes out of the brainstem, right? It's got to go through the skull, so it's got to find a hole to go through. It goes through the internal acoustic or auditory meatus, same thing. So see if you can find the internal acoustic meatus. Internal acoustic meatus right there.
No, because it has your middle ear.
All right, where's the external
We made
acoustic
that mistake
meatus?
last time.
That's right.
It's on that
Exactly,
bumpy.
that's what you look into to see the
Why does it go through?
tympanic.
Why?
What? That's an
That's what we
excellent
asked
question.
last time again.
So why doesn't it go through?
Oh, it's
Because your
meatus.
middle,
Middle ear
Well,
bones.
it's a tube, right?
your middle
It's
ear.
getting stuck on something, right?
Eardrum. Eardrum.
Ear bones. Middle ear bones.
Okay, so what the you've got an outer ear, an inner, middle ear, and an inner ear. Middle ear is on the inside of the outer ear is from the external orifice to the tympanic membrane. Middle ear is tympanic membrane to the inner ear. Inner ear is what? It's bone, right? It's bone. So this thing is called the pars petrosus. The inner ear is in this thing. All right, and we're gonna break this out and see if we can find the inner ear.
Oh, creepy.
All right, so the inner ear is in bone, right? The middle ear is this cave with ossicles and nerves and muscles. The inner ear is just a sensory organ inside the bone, so that's why it's getting stuck, because there's bone in between. All right.
Yeah.
All right. So internal acoustic meatus, 7 and 8 go in there. 8 just stops and hits the cochlea semicircular canals. 7, there's a ganglion in there called the geniculate ganglion. And the geniculate ganglion is called the geniculate ganglion piece. It sits there, and what happens is 7 comes in, and then 7 turns in various directions. All right? All right, so cranial nerve 7 has 2 components, a motor component and a sensory component. Why do you have this ganglion? What's in the ganglion, do you think?
Sensory cell body.
Sensory cell bodies. That's why you got it, right? So it's exactly like this. It's unipolar, pseudo-unipolar cells that will send off one fiber back into the brainstem, into the solitary tract nucleus, right? Because that's for taste. And then the other one goes out, and we're going to talk about its direction, but essentially it goes through what's called the chorda tympani, and then that hooks up with cranial nerve 5 and runs with the lingual, right? So these are cell bodies in here. That's where the cell bodies for
Comes from
taste
here?
are. Yeah.
That- the
Well,
anterior?
it's really, yeah, it's really coming from. This is where the cell body is. So one process goes through and synapses here. The other one shoots down the chorda tympani, and that hooks up with lingual, and that goes the anterior
2/3
2/3 of the
tongue.
tongue.
So this is
And that's
sensory.
taste. That's
Yeah,
it.
that's the
Special
anterior
sensory,
2/3.
right?
Yeah.
So 7 is taste and 5 is sensation.
You're right.
Right.
Or the anterior 2/3.
Right.
okay.
Because motor.
Right. And that makes sense, right? Because
Right.
this is general sensation, special
No,
sensation.
Right.
This goes to the trigeminal tract, which makes sense.
Right.
Whereas this goes to a special taste
that's
nucleus.
right.
Yes.
Solitary tract
Muscle
Yeah.
desiccation.
Yes.
The lingual is not motor, right? Like there's no the
It's all
motor
sensory.
from cranial nerve 5. It doesn't go through lingual, right?
Well, it'll travel. There's that big stem, right, that comes out, and it immediately breaks into a lingual and breaks into an inferior alveolar. We saw that, right?
Yeah.
Those are basically 2 sensory fibers. But there's like another stem that comes out, but then breaks up really quickly.
Okay.
All right.
5 is sensation, 7 is taste.
General sensation for 5, special sensation for 7, taste. All right, so
If I can ask you a quick question.
Yep.
For general sensory for 7.
Not quick enough. Let's move on. No, just
Come on, Niket.
So, how does that, like, where does that enter?
general
from?
sensation
Yes.
for
Like, I think it does, like, the external ear or something.
yeah,
But we
yeah.
don't have to know that.
I hope not, because I can't answer it right off the top of my head. But it's got to go into the trigeminal tract. And
Five,
but
okay.
where are those cell bodies? They must be embedded in here too. Geez, I should know that. There's got to be general sensory.
Blame it on your
thing
trip.
there. Yeah. jet lag.
Are you going on another trip next week?
Yeah, right around test time actually.
That's why we're doing.
Okay, so no, I'm not. I've got this another commitment. Basically, I got a whole bunch of commitments. So sorry. Now I'm really confused. Where do we leave this off? Okay, so we got the geniculate ganglion.
Sorry.
All right. So let's
Gosh,
do
Niket.
let's do the easiest thing first. So let's just talk about motor innervation, the motor branch of 7. So where's the motor nucleus of 7 on that picture? Yeah. So that should be it right there. So that's just going to shoot out.
Sorry.
Yep. Motor 7
Right here.
should be that. No, this one didn't have that.
Oh, here, motor nucleus is 7.
You do. It's
It's
just
there, it's
not.
there.
Yeah, the name is just on the side.
I think yeah, that one. Yeah.
Yeah. The motor nucleus is 7. Yeah. All right. So that just goes through internal acoustic meatus. Yep. I think that, it's that one.
Sorry, you were looking at that.
Okay. Anyway, 7 motor nucleus goes. Motor fibers go through the geniculate ganglion, and they immediately go south. Right? They immediately go inferior through what hole?
Do they have cell bodies here, or they just go straight
They
down?
just go. There's the cell body right there. So they just go straight through.
Okay.
And what do they innervate? And what does it go through? Muscle-facial expression, posterior belly digastric.
Stylomastoid frame.
It goes through stylomastoid foramen. Where's the stylomastoid foramen?
Straight.
I'm just gonna guess. Between the
There
styloid and
somewhere.
the mastoid.
Smart bet.
What's this right here?
Styloid, right there. Yeah?
There, exactly.
Shall we?
I'm wrong, right?
Okay.
Yeah.
Yay. Or maybe I should put it over here.
Go for it.
I'm like watching the
That's
camera.
it, right? All right, this is mastoid. What attaches the mastoid? Sternocleidomastoid. There's a groove right there. What attaches to that groove? Big groove on the medial aspect of the mastoid.
I don't remember.
Yeah? You see? Yeah. What attaches
just-
them?
Some mastication muscle.
Yeah, which one?
Kind
of.
No.
No.
What does it start with?
P.
P.
Yeah.
It's not placenta, is it?
No. Posterior belly of the digastric. Posterior belly of the digastric, right? It's here, slings down, and goes to the mandible, right? Posterior belly digastric in that groove. Mastoid. There. You got that?
Yeah.
There. Huge groove right there.
So
Yeah?
is this the internal
Acoustic
So the ganglion is outside of that?
No, it's on the.
In that
Well,
wood.
it's in the bone. So what we're going to do on our last dissection is we're going to break through this bone and we're going to try to find that ganglion.
So on the picture, would it still...
So here's the hole. Here's the hole for 7.
Like, is the hole on this side of it or this side of it?
It's here. It's on this side of it, right there. There's
So then the ganglion has to be external to...
the brainstem, but inside the bone.
Oh.
Right? So there's the hole for it right there. We're going to break. That's the internal acoustic meatus. We're going to break through that to get the ganglion. Now the motor just goes through here. Motor and sensory are both in this green whatever bristle, whatever wire. But the motor part is going to branch off real fast and go directly inferior.
Okay.
All right.
So it's coming out. Okay. I'm out of it.
Yeah.
People usually pass MD6 anatomy, right?
Yes.
Okay.
All right.
More than 50%, then yes.
All right. So that's the motor branch. Motor branch is going through there. Sensory branch. Let's do this. Let's talk about we got the motor branch, but we got a parasympathetic branch. All right, and that's from the salvatory nucleus. Salvatory nucleus, and that should be this little one right here. Salvatory nucleus. That's parasympathetic innervation to the salivary glands, right? Makes sense. All right. So we got to go from this nucleus, right, in the brainstem, to the pterygopalatine fossa and the ganglion, right? So we got to go from here, the brainstem, right, and we got to get over here. All right, and that's what on this picture is represented by this pathway. So from basically here, we got to go up through the pterygoid canal. We got to go through pterygopalatine ganglion. We got a synapse, right? Because the parasympathetics, that's where the cell bodies are, and then we got to get it up to the lacrimal gland. All right, so let's take our wire and trace that out.
It's going...
It's going to here,
Oh, wow.
lacrimal.
Where's the synapse?
Its synapse is here.
Oh, so it goes like this, synapse to here.
Right.
Which one of the branches is it?
It goes through the zygomedicofacial, zygomedicotemporal.
Does it matter
It follows with
if it's
V2.
above or below
Oh,
this?
Doesn't
Doesn't
matter.
matter.
Where was it? The perfect?
This is gonna make me seasick. Trying to
All right, you guys, you understand the concept here?
Yeah, I understand
Yeah.
the concept.
Okay.
Well,
Boy,
so it
it's-
doesn't go through the internal auditory, or it does.
What it does, yeah, everything, all of seven's got to go through the internal acoustic meatus, right?
Where does
But when it hits the geniculate ganglion, it's going to break up.
it's gonna go up?
What it's going to do is it's going to go forward. So let's follow that through. So parasympathetic through the brainstem, everything goes through the internal acoustic meatus, right?
Yeah.
Everything goes through the internal acoustic meatus. There's the internal acoustic meatus. When it hits that pars petrosus, geniculate ganglion's in there, motor goes down, but what happens is the parasympathetic goes forward. It curves forward. And it's got to get out of this pars petrosal mode, right? So the way it does that, it goes through this little groove right here called the groove for the greater petrosal nerve, right there. This is a really good one. See this?
Oh.
See this groove right there? That's a
Oh,
groove
I
for the
see.
greater petrosal nerve right there.
Oh, it's
That
on this
one right
side.
there.
Okay.
Is it this?
Got it.
This one. See this huge groove right there?
Okay.
And it leads to foramen lacerum. You got a bunch of them, but here's a good one that's running up this way to foramen lacerum.
Okay.
Did you see it, Kara? So it's basically that, and then it goes right to foramen. Well, your foramen. Yeah, this is going this way,
What is that
and it goes
lacerum
through
called?
foramen lacerum. That's the groove for the greater petrosal nerve.
Oh yeah.
To
that's
foramen
super
lacerum.
unique.
But there's a foramen there too, right?
Well, yeah, but it's this big groove right here. That's where the nerve goes.
So it's-
Is that called something? That
That
foramen?
no. I mean, you just have a lot of calcification there. Did you find? No, that's foramen spinosum. So the groove for the greater petrosal is yours is
Right here.
Yeah, use this one.
yours is confusing. Sorry. That's a pretty good one right there. See how that's running right this way through the foramen.
That's a good one, isn't it?
All right.
How
Oh
about
yeah.
just on that half skull?
Yeah,
That's
this
a
is
good
really
one.
nice. Right through there. Just show that to those guys.
What's that?
All right, so those are parasympathetic efferents from 7 going to the lacrimal gland. All right.
Cool.
All right, so anyway, parasympathetics going forward, hit foramen lacerum. What's right at the base of foramen lacerum on the other side? Pterygoid canal, right? So greater petrosal runs this way. We're right at the base of the foramen lacerum, and that's where the pterygoid canal is.
So on this,
Can you point it out?
Kind of.
And it's by the medial. Okay.
Not so
More
good on this
medial
one,
than
but-
the one where
so it doesn't, does it goes through
This one.
foramen lacerum?
7, the greater petrosal nerve. Here.
Get to the canal.
Right there, shoots through.
Oh, that's how it gets there.
Sorry, shoots through. And you're right at the base of the foramen lacerum. That's where the pterygoid canal is. That's where this thing is, right
So
there.
it's this?
Yeah.
Is that it
Yep.
again?
Yep.
Okay.
Yep. So this right through there,
So does this guy.
right through there, right through there, foramen lacerum,
Did you guys all
Goes
see?
down,
and you're right at the
Okay.
base of the foramen lacerum into the pterygoid canal.
The pterygoid canal medial.
Right.
Oh yeah, I see. So the
That's it, right?
See it kind
so the last room would be like somewhere there. on
Yes.
the diagram?
Yes.
of
Yes.
now.
Yes. Make sense?
Okay,
All right.
can you show us on these sculptures?
Sure, maybe. Thanks. All right, so you're going through here, you're going through here, you hit foramen lacerum. You pop around to foramen lacerum, and I can't show it to you on the skull because I'm not seeing a nice big hole. The hole should be right in here someplace,
Okay.
and that's the pterygoid canal. So,
This one's easier to see.
so going through here, foramen lacerum, pops through, and the hole should be right about here someplace. Well, I'm not having much luck on this either, but you understand what I'm getting at, right? Yeah. All right, so if you run that string the whole way through, you end up in the pterygopalatine fossa and ganglion, and that's where those cells synapse. They synapse in that ganglion. All right, and then the postganglionics still have to get up to the lacrimal. So all they do is the postganglionics hit you right up with the zygomaticotemporal, zygomaticofacial nerves, which are cranial nerve 5, and then they tend to go through these holes right here, zygomaticofacial right there. There's a zygomatic, well, it's kind of broken out, but a zygomaticotemporal here. All right, and then the lacrimal glands right there. So zygomaticofacial is right here.
Oh, okay, the little ones.
The little ones. Zygomaticotemporal, not so good. I'm not really seeing much of one, but usually there's a hole back here. There's a hole here and a hole back here.
Okay, so in front and behind the zygomatic
Yeah, and
arch.
it's front. The zygomaticofacial
Okay.
is there. Zygomaticotemporal back
Posterior
here.
to the arch. Okay.
And what are those for?
That's
These two.
these guys right here. That's these guys right here. That's how it gets up to the lacrimal gland. So the postganglionics come up with 2 because that's going through pterygopalatine fossa, and the postganglionics run up with zygomaticofacial, zygomaticotemporal through the bone. Zygomaticofacial is good right there.
Okay. Temporal.
Zygomaticotemporal is usually behind here someplace,
Okay.
maybe back in there. Usually it's a pretty big hole.
So, Dr. Logan,
Yeah.
I don't see temporal, but facial is good. And zygomatic
This one?
facial.
Is it this one or
Well,
this one?
I got to admit, I'm probably not going to ask you zygomaticotemporal, zygomaticofacial.
At
I'm going
first-
to ask you things like infraorbital.
maybe
I'm going to
this
ask you
little-
things like palatine.